Today we're in Florida. We're here to speak with Joe Navarro. Joe is a body language expert and the author of Louder Than Words and What Everybody Is Saying. He's here to have a chat with us about what we can hear from our patients that they're not saying with their words. Today we're in Tampa. We're here to speak to Joe Navarro. Joe, thank you so much for speaking with us.
It's my pleasure.
So you're an expert in body language.
Yes.
How did you get into that?
Well, I think in part I developed an interest in it when I came to America as an immigrant, and I couldn't speak English, so I was reading the body language of the people around me. And then when I was in college, I just thought this is something that needs to be studied because it's something we do every day, communicate.
And did you study it at college or?
Well, what I found was in the 1970s, there really were no classes on body language or nonverbal communications. Some books had been written on it, but no classes were being offered. So I just started studying it, and then by the time that I got into the FBI, they allowed me to study it on my own, and so I took the time to study it then.
And how accurate do you think it is?
Well, it depends. I mean, it does often reveal our feelings. All our emotions are revealed non-verbally. It can reveal sometimes what we're thinking about something, whether we like it or not, and it often reveals our intentions.
Most people that are going to be watching are health professionals. Do you think it's important for us to understand what our clients are maybe not verbally telling us?
Well, I think of all the professions, probably the medical profession would benefit most, because we know from studies that nonverbal behavior does affect the health of a patient. For instance, how often they're touched, the frequency, a warm hand, and so forth. But also things, for instance, how we talk to them. For instance, a physician who tilts his head or will probably be perceived as kinder and more understanding than one that is more erect and so forth.
What if they naturally don't tilt their head?
Well, then that's something you work on.
Yeah.
It's something you work on. It's you know, life in a way is theater, and so you want to encourage the forthcoming of information. So one of the things that you can do, for instance, is do the head tilt and the eyebrow flash, where you arch your eyebrows. You know, people at first that seems weird, and yet that's how we greet family members. Well, physicians can use this, for instance, with children, to set them at ease. So the first
Makes
time
them more comfortable?
Yeah, well, the first time they come to see a doctor, instead of just saying, "Hi, Susie," or you know, "Sam, how are you?" you arch your eyebrows and go, "How are you?" And children actually think they've known you for far longer.
Wow.
And so it makes them more relaxed in the interview.
And what about how we sit? So there's a lot of people that suggest, you know, we sit behind a table so we can write, and there's some people that suggest we sit to the side, and there's other people that suggest we sit like this. What do you suggest?
Well, the research is actually very forthcoming in this, and that is that when you sit directly in front of someone, that's the way to get the least amount of work done. That we actually get the most done when we're sitting exactly as we are, at angles, close together, but not face to face, which tends to be more of a confrontational sitting style.
What if we have to use a computer? Where would we put that?
Well,
we have to write notes or something like.
Yeah. Well, what's recommended is that you angle the computer screen away so that if somebody does come in, that you can make eye contact. The thing to do is to think about is not have objects that act as barriers.
Okay. And what about like with what they're saying to us? So what can we read from when we're giving someone advice? Yeah.
Well, principally what we read is comfort and discomfort. So one of the things that we look for is the person becoming more and more comfortable, because we know that people will reveal more information when they're comfortable.
Yeah.
People will be more settled. It's part of the therapeutic approach to have less stress. The more stress an individual has, the less healthy they're going to be. They're also going to communicate less. So we want to create an environment of comfort. So we look for things such as, are you warm enough? You know, a lot of times people come to a hospital and they're in shock.
Yeah.
They're already cold. We look for signs of discomfort. Maybe they're scared. Maybe they have anxiety. You know, quite a large portion, really, of the population has anxiety disorders, and of course, a medical setting may exacerbate that. So we look for these things, which usually manifest around the eyes. You see the squinting of the eyes, or the narrowing of the area between the eyes, or exactly, very good, or the crinkling of the nose. A physician might suggest a course of treatment, and the patient sort of crinkles the nose. There may be an issue there. There may be an issue, let's say a single mother who can't take time away to do what she needs to do, or there may be an issue of money or some other thing. So very accurate tells. Here's one where women will touch their neck, right, in this little area right here. And this is indicative of deep emotional concern. And this is something that a physician can be looking for, to say, you know, this person is really going through something very painful here. And we know it because there's a lot of neck touching and so forth.
And is it the same for everybody?
Well, there are behaviors that are innate, and then there are behaviors that are cultural.
Yeah.
The things that I talk about in my books are behaviors that are innate, that we see them across the board. And what's interesting, many of these, for instance, eyelid closure. You ask your neighbor, want to help me move? And they go, yeah, I'd love to. And this closing of the eyes, well, what's happening is it's a blocking behavior. Well, here's what's fascinating. Children who are born blind, they've never seen, when they hear things that they don't like, they'll cover their eyes.
Same thing. Wow.
And so this is a behavior that is tens of thousands of years old, and it serves a purpose. So we look for the behaviors that are innate to really tell us about how we feel emotionally. Yeah.
And is the face the only way that we can find out how people are feeling, or what if?
Oh no! You look at the whole body. For instance, there's something called ventral denial. When we like someone, we turn our ventral side towards them, our belly side towards them. When we don't, we sort of pull away and we distance ourselves. This is very accurate. Even our hands, for instance, how we touch each other in a relationship. And patients feel this when a doctor puts his hand on the shoulder. There's a big difference between putting the fingertips on the shoulder and putting the full hand, which is warm and comforting.
Yeah.
And patients actually can feel that difference, and that can generate positive feelings towards that doctor, which is part of the therapeutic message.
And how do you study this? Like, how did you come up with these answers? Or
well, fortunately, over the years, there's been a lot of researchers, and that's one of the things that I strive for is in all my books is to make sure that this isn't just something that somebody made up.
You've got a great reference list.
Yeah, the research that went on between 1980 and the present is just incredible, because now we can actually look at the brain as it activates, as it does different things. We can see the amygdala, for instance, when it reacts to a negative stimulus. We couldn't do that 12, 15 years ago. So there's so much research now. We really do understand the brain a lot better. And we know that all behavior, unless there's a disease, all behavior is governed by the brain. So there's a reason for why we do it. I'll give you an example. You see a young lady at the airport, maybe she's playing with her hair. That's a very soothing, pacifying behavior. What the brain is saying is, look, it's stressful here at the airport. Normally I wouldn't do this, but because it's stressful, I'm going to play with my hair and calm myself down. So when we look at a behavior, we break it down and say, well, why does the brain require this? And for one of several reasons. One, either the brain actually requires it or it needs to communicate it. Like, for instance, you'll see someone is struggling with maybe plugging in something or fixing something, and they'll compress their lips. They'll go like this. What they're actually doing is communicating to everybody around them, saying, hey, I'm struggling here. If anybody has a good idea, help me out, without having to say it. So we can look at behaviors and say, well, that's part of our social being, that we communicate non-verbally a lot about what we feel and what we're dealing with, and even our feet. You'll probably notice this when you're talking to someone, and all of a sudden you're standing on a sidewalk, and one of the feet all of a sudden orients away, and you know this person has to leave. Maybe they're running late or whatever, but that foot very accurately points in the direction in which they need to go, and it's activated right at the moment where, okay, now is the time. And we're very fortunate that we have these behaviors that are so accurate. In the same way that if you approach, for instance, the Grand Canyon, you're not going to bound over to the ledge. You're going to cautiously come over.
Yeah.
It's your brain that's directing that behavior, and so we capitalize on it.
And is there a way, if we're talking with patients, that we can, use our body language to make them more receptive to taking some of our advice, or?
Sure. There's we've talked about greeting them with the eyebrow arch, the head tilting, and so forth. But for instance, emphasizing. Rather than presenting everything at the same tone, which many physicians tend to do,
you've got to A, B, C.
Right. Emphasizing, but emphasis isn't by raising our voice. Emphasis is by lowering our voice. And so the lowering of the voice is a nonverbal. So you pay attention to me because I say, if you don't do this, you're not going to get better. And so they will remember that longer than if you said it all at the same pace.
Same level, wow. Yeah. And what about when we're asking them about some of their behaviours? And like, I'm trained as a dietitian, and I think they found that 70% of people tell you a lie about what they're eating, but not intentionally. How do we guess that?
That's a good point. A lot of people just they self-deceive. They have no idea what they're consuming. So one of the things that we can use nonverbals for is, we know that by establishing comfort, people will be forthcoming. So when you say, well, is it possible that maybe you had a snack after 8 p.m.? You do, don't you? Okay. So by using the nonverbals, we can get them to give us information. But here's another one that we don't often think about, and it's called the halo effect. And it has to do with people who are in authority. Yeah. And the way that we present as someone who is a healer, who is a professional, who can be counted upon, that alone can assist in healing individuals, because we gravitate towards people who are these archetypes, the healers, the leaders, and so forth. So if we act the part, there will be those that will follow along. Yeah.
And what about our dress? Like, does that have any impact of what patients or fellow co-workers think of us?
Well, I'm sorry.
How we dress.
How we dress. Well, yeah, it certainly does. Wonderful studies that have been done on the difference, for instance, a person wearing a business suit versus a tie versus a turtleneck. The person in the business suit gets more attention, gets more respect than, for instance, something so simple as that. And obviously people say, well, it isn't fair. It may not be fair, but that's what we're primed to do. We respond to that. We respond to, for instance, I saw a study where an individual had very long nails, but they were dirty. And it was difficult for him to understand that people weren't respecting him because of this, that his patients were sort of orienting towards that. Yeah. And So there are little things that we can do to tweak ourselves and say, you know, our clothing should not detract. Our clothing should entice. Our clothing should inspire, but not detract from the message that's being given. So there are things that we can do. Sure.
And some of these things, you know, it takes a little while to notice how people's feet are or how their face is and things like that. How do we make ourselves be a bit more observant of these things?
Well, that's something that fortunately we can all train ourselves to do. You know, obviously looking at the literature that's out there, and there's a lot of great literature that now exists, and then practicing it, learning to observe and noting that, you know, okay, well, that person just squinted, or they just touched their neck, or they compressed their lips, or they bit their lip. You know, we bite our lips to pacify. Yeah. These messages have meaning. I'll give you another example. You know, we often ignore the hands, and yet we know that when the hands touch like this, we're just relieving a little stress. But when we touch our hands like this means there's a lot of stress. We're interlacing the fingers between hands, and so we have to learn to differentiate between little behaviors. Yeah. That say, no, there's more stress than there was earlier. So
with your books, do you suggest reading them straight through, or reading a bit and trying to be more observant of that to practice? Or
well, that's a great question. I've had students and readers look at it both ways. I've had some that say, you know, I've read it in 3.5 hours, and now I'm going back and taking notes. And I've had some that say, you know what, I'm going to study, for instance, the feet or the eyes or the body language of the arms, and I'm going to perfect my knowledge of that before I go on to the next. I think that's very individual. What I think is important for everybody to know is that you can improve your observational skills, but you can also improve your ability to decipher what those tells are. Yeah.
And as a health professional, what do you think? You might have said them before. What do you think the 3 most important things about nonverbal communication are that we should know about?
The 3 most important things, number 1, they're universal. They are the lingua franca of the world. If you're traveling, this is the language that we get by. Number 2, we establish trust not with words, but with body language. Whether or not I trust you or feel comfortable around you, strictly with body language. And number 3, we can influence other people through our body language, and it's the principal way that leaders, everybody from Alexander the Great to presidents to prime ministers to military leaders, this is how we influence other people.
Joe Navarro, thank you so much for speaking with us.
You're quite welcome. It's my pleasure.
As you've just heard, when we speak with our patients, it's not just what we say, but how we say it and how we use our body. Joe, thank you so much for speaking with us today.
Oh, you're quite welcome. Thank you.